Hello, good morning. Today our topic is falls. That means the person is falling to the ground with preserved consciousness. This may be due to various factors related to the patient or related to the environment. So, there are umpteen number of causes for the falls, starting from the, problem with the joints, problem with the muscles, from the spinal cord to the brain, and any secondary factors like change in the blood pressure, in the sodium level, low sodium level, low hemoglobin or anemia, or various other psychosocial factors. There are of course causes like a syncopal attack, stroke, epilepsy, and syncope in pregnancy, and various comorbid related diseases. So, it is quite common in the population. It is said that up to 1/3 of people above the age of 65 develop a fall at some point of time, maybe per year. And roughly the population studies showed that around 8% people fall at some point, and it would rise to 80% if the patient is more than 80 years, and 10% of the fall can lead to either injury, trauma, even death. This can lead to problem to the brain like a head injury, subdural bleed, or any facial injuries, injury to the spine, injury to the spinal cord, fractures of different bones like a spine fracture, long bone fractures in the upper limb or lower limb, and even hip fractures. And of course, the patient will be left with morbid fear of falling in the future, something like he would always cling to someone, or he would need some assistive device to walk in the future. So, there are both physical comorbidities as well as psychosocial comorbidities following the fall. Of course, there are multiple factors which would precipitate, which would worsen the risk of the chance of having a fall, like elderly, people above the age of 80, and people with a depression, with a stroke, with a dementia, and with various problems, the cerebellum, the brainstem, or the basal ganglia like a Parkinson's, or various disease related to Parkinson's. It is called Parkinson plus syndrome. There are various conditions related to the cerebral like a spinocerebellar ataxia, or some injuries or toxins, infection, or some damage to the cerebellum or cerebellar connections, or maybe problem in the ear, inner ear disorders like vertigo or vertiginous related symptomology, or any problem in the vision, eye, even the contrast sensitivity, abnormality in the contrast sensitivity, or problem in the spine, something what we call the craniovertebral junction anomalies. Sometimes they can be problem in the spinal cord, what we call as a myelopathy, maybe as compressive myelopathy or a non-compressive myelopathy. Then of course, there are various conditions related to the muscles, various muscle diseases, maybe various neuropathies like peripheral neuropathy, sensory neuropathy, large fiber neuropathy, motor neuron diseases, radiculopathies, various things like Kodaikana and other related conditions. So, there are so many causes for the neurological causes for the falls, and of course, there are problems with the psychological factors and problem with the various drugs, because there are certain drugs which would dramatically decrease the blood pressure when you are erect or in the upright posture, like diuretics, vasodilators, or centrally acting drugs. So, if the person is developing any of the so called blurring of vision or graying of vision or blackout, they should assess the blood pressure, maybe in the lying posture, then after 2 to 3 minutes of standing, and observe for any postural apparent fall of the blood pressure, maybe the 20 millimeters or 10 millimeters of the systolic and diastolic respectively. In those cases, you may have to reduce the dose of certain medication or avoid some medication which would precipitate a fall. So, we have to know, because all these people, the aforementioned people like with a different neurological problem, psychological problem, various infections, and problem with the heart like various cardiac cause of syncope, and some epilepsy, something what you call you make a sound that called a startle epilepsy, or any sort of jerks and getting a fall. Some people get some sudden jerks and they tend to fall. Some sort of epilepsy, myoclonic epilepsy, we call it as myoclonic epilepsy or startle epilepsy. And there are condition, like problem with the low blood, like anemia, low hemoglobin level, low sodium levels, or problem with the endocrine profile, like hypopituitarism or hypothyroidism or even Addison's. In all these conditions, patient can have changes in the blood pressure on standing or on walking, and they tend to fall. So, there are so many conditions, probably it is related to the differing cause, maybe from the neurological aspect or from the general medical aspect, or maybe from the environmental. So, basically there are certain conditions which can run in families, something called the spinocerebellar ataxia, so or various Parkinson's disease, but those things are extremely rare. So, you should know that 10% of the fall can be fatal or can lead to grievous injuries to various vital structures in our body. So, it is of utmost important that we should know the various causes of fall and what you should do in case of fall and what are the preventive aspects, and is there any drugs available for the fall or for the cause of the fall. So, of course, when we examine, we have to examine for any postural drop of the blood pressure, because it is of utmost importance, because if the patient tend to have some sort of a giddiness or graying of vision, you have to adjust the medicines to such an extent that he would not fall in the next time, right. Then you should treat the basic condition. Supposing that he has got a problem with the low hemoglobin, treat the anemia. If the blood sugar is low, we have to correct the blood sugar level, or if there are any endocrine abnormality, we have to treat the endocrine abnormality. And of course, any cardiac illness, any rhythm disturbances, or any vessel abnormality like a subclavian steel or vertebrobasilar ischemia, you have to treat accordingly. And of course, any problem with the neuraxis, maybe the problem in the brain like Parkinson, cerebellar problem, vision problem, vertiginous problem, or problem in the joints or in the muscles or in the nerves, you have to treat those particular condition accordingly. And of course, sometimes the blood pressure may be still low. In those cases, your patient or the person should take more water, more salt, and she shouldn't move up and about very fast when getting up in the morning. So, it is better that they should sit up in the bed and do some stretching exercise before moving about, and they can use a elastic bandage, take more salt, and there are certain drugs which will raise the blood pressure. It is known to many all physicians and neurologists and other doctors. So, we have to treat those, because sometimes if you treat with those drugs, sometimes it can give rise to hypertension, the supine position called supine hypertension. So, you may have to use a low dose of antihypertensives at night in case of supine hypertension. So, there are then of course, there are various factors at home, because the patient is at home and he would fall due to various causes like improper lighting, the furnitures, and the carpet, and various other factors related in his house. So, ideally a physiotherapist or an occupational therapist should go and visit his house and see what are the defects or deficits in the house or even in his living area, so that it can be rectified. So, we have to assess any gait disturbance, whether any problem with any walking abnormality, any balance abnormality, any joint abnormality, or any weakness of the limbs, or any neuropathy or vision abnormality, hearing abnormality. So, it is a multifactorial, multifaceted. So, you have to start from one end and reach the other. Then there are certain conditions called phobic vertigo, or means phobic postural giddiness or imbalance. Here what happens, the patient must have had a fall or a vertigo in the past, and he would be extremely anxious so that he wouldn't walk next time or in the future. So, what happens in those cases, you may have to have a psychotherapy or a counseling and a gait therapy along with all the supportive care. So, in short, falls is quite common in the poor population. It increases with increasing age, and there are so many comorbid factors which would precipitate or increase the chance of getting a fall. So, you have to know which are all factors would precipitate a fall, and what are the various risk factors for that particular individual, and how can we correct all those factors and modify his life or the prevent the chance of getting a fall, and various drugs which would help him to increase the blood pressure. And there are so many endocrine profile which you have to correct, like adolescence or other pituitary abnormalities, or any problem in the electrolyte imbalance like hyponatremia, low hemoglobin level, or any sudden fluctuation in the blood pressure. And you should have a coordinated activity between a neurologist, between a physician, a psychologist, a psychotherapist, and an occupational therapist. And with that, I think we can achieve a good level of independence to the patients in the form of good normal walking. And he can also use assistive device like walking sticks, tripod, and walker, along with all the supportive care. So my talk ends here. So let me conclude, and that's fall is quite common, and you should prevent falling, and you shouldn't lead a patient to fall, and you have to prevent falls by knowing what are the factors which would cause fall, and what are the various precautions that you should take. Okay, thank you very much.